everyone making time. And we're now recording. It's a busy time. I know we've been wrapped up with the endangerment finding testimony and hearings. So that's been occupying some of our time, but we appreciate you showing up. And I'm going to go ahead and start sharing my screen. Can everyone see this? Can I get a thumbs up?
Not yet.
Not yet.
Oh, there we go.
Okay,
Yeah.
great. So, obviously today we're joined by the MDHHS crew, Carolyn Cook and Aaron Ferguson. But before we get started, we just wanted to share some resources here from the Michigan Clinicians for Climate Action. A quick introduction. My name is Teresa Homsey. I'm the new Deputy Director of MiCCA. I'm joining the team here just a month and a half ago, so I don't recognize all the names, and maybe some of you are new, but I'm definitely new here. So we're going to hear about how Michigan is being affected by climate change, but we do have an ongoing campaign where we are collecting climate health stories from either medical students, nurses, doctors, healthcare professionals, and also patients. So I wanted to spotlight this before we get started, just to over the course of the presentation, the presenters are going to talk about some of the impacts. And if you're starting to connect the dots between some potential, say, experiences you're seeing in your practice with extreme heat or flooding or power outages, please scan this QR code and share your story with us. This is this is part of our effort to build this database, which helps make climate change a kitchen table issue. And some of the stories that we've already highlighted here include medical students' experience treating a man with extreme heat who, while going to a psychiatry appointment and walking to a bus stop, he grew confused and dehydrated. He missed his appointment and then ended up having to be taken into the hospital. We also heard students who have dealt with flooding that then led to mold growth and which exacerbated, their asthma in their home. We heard a really compelling story from a teenager who has a chronic, basically lifelong struggle with Lyme disease after a tick bite went undiagnosed, unrecognized, and she struggled to get access to care, which now causes her to have chronic fatigue, and also she struggles with mental health problems on top of that. And then we have an emergency nurse in Detroit talking about how power outages during winter storms resulted in people being exposed to hazardous conditions. So this is just a variety of stories that we have. We have a much larger database. So this QR code will take you to the link on our website where you can share your story, but also review some of the other stories that we have already collected. So please take a moment, get that, and we'll share that in the link in that as well, the link to this page. So I figured that's a good way to frame the discussion, and I'm going to pass it over to Carolyn Cook and Aaron Ferguson from MDHHS.
Thank you. Funny because we have a Caroline in our group too, so there's often between our team, Caroline and Caroline, we all get confused. Thank you for having us. Aaron and I are going to talk about public health and climate change in Michigan, and I am going to jump right into it, into our agenda. If you could advance this slide, please. Thank you. Right, so we're going to talk about how Michigan's climate is changing, and since we are the health department, our concern are those impacts to people's health. We're also going to talk about the intersection of climate change and health equity. And I'm going to turn it over to Aaron. He's going to talk about our program, Michigan Climate Health Adaptation, and how we're responding. And then how healthcare providers can be a key player in climate change adaptation. And we do have some discussion points sprinkled in there because we really would like to hear from you as well. And next slide, please. Okay, so first let's look at a few indicators of how climate change is already impacting the Great Lakes region and Michigan. So generally when we're talking about climate change, we're talking about the change in the area's temperature and precipitation over at least a 30-year period. And so now I'm going to go into a bunch of numbers, which you've probably seen these before, but since the mid-20th century, we've seen an average annual temperatures increase 2.5 degrees Fahrenheit across the Great Lakes states. And then in Michigan, specifically, there's been an increase of 2.6 degrees Fahrenheit. So this has played a part in the 16-day frost-free season. Translation, a 16-day increase in the growing season, which also relates to a longer allergy season. Moving on to precipitation, total precipitation across the Great Lakes states has increased 16%. And for Michigan, there has been a 15% increase. And more of that precipitation is actually coming down in heavy downpours, with a 37% increase in heavy precipitation events. So this is, GLESA has put out an updated report pretty recently that goes to 2024. That didn't make this presentation, but that is out, and I can put that in the chat at some point, that link in the chat a bit later. Next slide, please. So unfortunately, some of us have seen the damage brought on by some of these storms that cause flooding. If you remember in 2018, the flooding in Houghton, a 1,000-year flood event, nicknamed the Father's Day flood. Every time I see these pictures. Next slide, please. Yeah, really sad. And then again in Midland, 2020, a 500-year flood event. Next slide, please. And then again in 2021, a 100-year flood event in Southeast Michigan. And this actually was a compounding event with power outages and a heat advisory along with the flooding. And then next slide, please. Thanks, Erin, for putting that in there. And then emerging issues, wildfire smoke. So this image is from Detroit 2023, when Michigan experienced pollution from Canada wildfires. And as we know, climate change is a driver of higher temperatures and is changing precipitation patterns. And that's leading to drier conditions across the United States and Canada. So this during this time period, the unusually low precipitation led to that historically bad wildfire season with lots of out of control fires. And smoke from those fires on June 7th led to the first ever state alert for PM 2.5 by EGLE, the Department of Environment, Great Lakes, and Energy. And that was the first one that we've had. So climate change, is really likely to make these conditions persist into the future, and these events can occur again, or no, correction, they are occurring again. They're definitely occurring again, this summer being the worst. I know we were pretty busy this summer with air quality alerts. So health impacts from wildfire smoke cause difficulty breathing, for one, burning eyes, illness such as bronchitis, but serious health effects can be asthma attacks, heart failure, stroke even, which can lead to premature death. Next slide, please. Thank you. So these temperatures and precipitation and temperature are affecting our health in many ways. First of all, heat, it can strain the heart and lungs. Increased temperatures can worsen air quality, which can worsen respiratory conditions like asthma. And extreme heat can cause illness and even death. It was just a couple of weeks ago, I had a family member have an episode of heat exhaustion in Petoskey. I think they were just like at a farmer's market, and they were out for the rest of the weekend. But it's just interesting because the comment they made also is that it just didn't feel like Northern Michigan, experiencing heat exhaustion in Petoskey. Increased temperatures and precipitation also impact the spread of disease. The shorter and more milder winter seasons means insects, ticks, rodents can survive longer and expand their range. So we are seeing an increase in tick-borne diseases like Lyme disease, as well as West Nile virus transmitted by mosquitoes. And then the increased precipitation also threatens our water quality. Increased flooding can stress our infrastructure, such as sewage, drinking water, septic systems, and have occurrence of harmful algal blooms, which is increasingly common from warming water and an increase in runoff. The exposures to HABs, harmful algal blooms, can cause a number of health impacts, such as skin irritation, stomach pain, dizziness, difficulty breathing. And then finally, these extreme weather events, such as strong storms and flooding, can cause disruptions to our overall well-being and our physical and mental health. The increasing frequency of extreme weather events means that more people could experience a loss or trauma, environmental changes that impact livelihoods or outdoor activities, cultural traditions can worsen mental health for people. And then, of course, injury or illness from exposure to debris or chemical pollution and floodwater, mold growth in buildings. I think that was mentioned earlier. And then, power outages leading to carbon monoxide poisoning or food spoilage, or impacting the use of medical equipment, plus the reduced access to medical services from damaged infrastructure. And then, Tracy, if you could go back 2 slides, I want to say. Yeah, 2 slides.
Is this the right slide? Sorry, my
Oh, yeah, there we go. Now you're up. Perfect. Thank you.
okay, sorry
I
about
thought
that.
I thought we lost you for a minute. We got you there. Okay. So based on these climate conditions in Michigan, our program, we currently focus on these priority climate-related health impacts. So we're looking at respiratory disease exacerbation, especially asthma, heat, illness, and mortality, waterborne diseases related to extreme rain events, vector-borne diseases, especially Lyme and West Nile, carbon monoxide poisonings, and physical injuries related to extreme weather events, and then mental health conditions. Next slide, please. Okay, so we can't talk about climate change without talking about health equity. So, because the root causes of climate change and health inequities are often the same. So the systems that we rely on, food, energy, transportation, are also the drivers of climate pollution, and they shape the conditions that people live in. So this means that as widely addressed climate change, there is an opportunity to address these conditions in a way that improves health equity, because climate change impacts are not equally or fairly distributed across people or communities. So two components of that are climate vulnerability and pre-existing health conditions, and living conditions. So in the US, we know that these factors are shaped by socioeconomic status and race. And then plus, climate change is a risk multiplier. It exacerbates those existing health and social inequities. That worsens environmental conditions. Disaster recovery becomes even more difficult for those who have chronic health conditions or living with a disability or low-income households. So with a climate change interventions, they can also improve those health inequities. So for example, working to provide a neighborhood with trees can increase walkability. It can be one solution to reduce greenhouse gas emissions, reduce local flooding, improve health, and just may also provide more shade. So these are especially felt in low-income communities, often communities of color that are disproportionately hotter and more likely to flood in those surrounding areas. And then next slide, please. Okay, I mentioned climate vulnerability, and it's influenced by three factors. I'm not going to go into every, a definition of every one. I just want to illustrate it with a story, which is there's a young boy with asthma, and he lives in Detroit. So his exposure being, well, Detroit has a slightly greater exposure to climate hazards than most other areas in Michigan. So you have more extreme heat than surrounding areas, issues with basements regularly flooding, air quality issues stemming from proximity to industry, hazardous waste, and then also high volume highways. The sensitivity in this story is, he's a young boy. Children are more impacted by heat, cold, air quality, and pre-existing condition, which is asthma. At the community level, homes in Detroit tend to be of older housing stock and might not have air conditioning or air filters. But then there's also the adaptive capacity or the resilience of this story. Household income, of course, is a factor, but also social network or community resources. So perhaps there is a strong nonprofit or a Block club, community center in this person's neighborhood that can increase the family's and the community level's ability to be resilient in the face of a climate-driven event. And then next slide, please. Great, thank you. So I wanted to, we'll have more opportunity later, but I just wanted to open it for discussion now based off of, just kind of the health impacts that you've already talked about. That have you noticed any differences in your practice as a result of climate change? And if it has actually affected your work, we would love to hear if you want to share in the chat or come off mic.
Just to get the ball rolling, and I welcome other people chiming in. I can tell two stories that have just this summer. I received an email from a pulmonologist who basically had, he said, I'm getting these emails all of the time. And they're basically requests from his patients, either with COPD or asthma, saying that they need their medications refilled much rapid rate because of the wildfires. And he said that, he's getting multiple requests every single day. And it's very striking. Another story that I was told was who took care of a cardiac patient who was immunosuppressed after on discharge because he actually went through a transplant and was discharged home to a house unbeknown to the medical group that had mold in it, and then came back a month later with a systemic fungal infection. So those are just a couple, and I'm happy for other people to chime in. I'll see one comment. Definitely more kids with asthma during bad smog or quality days. Any respiratory illnesses like croup, RSV. They used to be thought of as seasonal, now year-round. Interesting.
I was gonna jump in. I know we have some psychologists and therapists and counselors in our network. And one thing that I found interesting this summer being just reading about seasonal effectiveness disorder extending into the summer. It's, traditionally seen as like a winter problem, with the short days and the cold and the limited time outside. But yeah, being up in northern Michigan this summer, I've been huddled away in my apartment more than I'd like to be, and that has been to put it bluntly, really depressing. So that's just more of a personal take. But that's another interesting side of, the mental health impacts as well.
Yeah, I agree. We actually, Aaron and I and our team were having a conversation, I think maybe 2 weeks ago, and someone had brought that up. It was a conversation with our local health departments. And we haven't, I think that was the first time I have heard of that as well, for extending to summertime and being cooped up. And when it does register, I feel it as well.
Stu mentioned seeing more Lyme disease as well. And there were several people who gave comments, and also in our climate health stories, there's records of mental health providers describing people who are considering not having children because of climate change. I don't know that that's a help, that might be a healthy decision. You could, but it's a sad that people have to ask that question.
Paula, I see your comment about the ice storm. Where are you in northern Michigan?
Oh, I'm in Traverse City, but we have colleagues all over northern Michigan, even further north. So Sheboygan, Petoskey, there's a lot of communities that really are struggling. We had the Small Farms Conference this week, and there was quite a few sessions on well-being for farmers this year. So that was good to see.
A lot of good information.
That's the report of chronic Lyme. It's interesting and sad. So, um, I know several people who have adult children, old, who have adult children who are struggling with chronic Lyme, and it can be really disabling. And yeah, it's really concerning. I'm sorry you're dealing with it.
Are we allowed to talk in? I wasn't sure. Yeah. So my name's Connie, and I have been in the environmental industry for a long time. Anyways, yeah, I wasn't planning on talking about Lyme tonight, but my concern is that it's going to get more prevalent here, and it's really sad what people with Lyme disease have to go through in Michigan. And so I was diagnosed 23 years ago. The testing wasn't that great, but it was pretty positive, and my husband and I were both sick. And U of M, head of infectious disease, told me I didn't have it, and that nobody in Michigan has it. And the doctors that were treating me were doing a disservice. So fast forward about 22 years late, about 18 years later, I just did a tick-borne analysis that cost a fortune, but found out I indeed did have Lyme disease, as well as 3 or 4 co-infections, and I'm learning a lot. I'm going through a detox right now for it. I've done a lot of stuff for the last 23 years, but it's just really sad. I think that people think it doesn't exist in Michigan, and that chronic Lyme is a real thing. So those are things that I feel like we should get the word out more of. And I am concerned for the people of Michigan if they haven't heard about it. So I'm sure climate change isn't going to help that matter very much. So if you know of anybody that needs any help or anything, let me know.
Thank you for
Thank you for
sharing
what you're
that.
doing. You're welcome. Thank you for what you guys are doing.
Thank you for sharing all these insights and your stories. I know that some of those I can relate to. I know we have some more discussion later. Do we want to go on to the next slide? Yes, I think that one's Aaron.
Yeah, sounds good. Yeah, we'll do some more interaction later. Thanks, Carolyn. Thanks everyone for being here. I'm Aaron Ferguson. I manage the climate and tracking unit at MDHHS, and I've been working on climate and health now for 11 years. And so when I started with MDHHS, we were part of the CDC's Building Resilience Against Climate Effects um, grant funding. We've since been able to help build up the program and sustain it outside of those CDC grant funds as they get tighter. But the Michigan Climate and Health Adaptation Program is the primary program that really focuses in on understanding how Michigan's climate is changing, um, understanding what are the causal pathways to health impacts, both direct and indirect. And then over the years, we've developed a lot of different communication, health education materials to try to educate the public and public health practitioners about these issues. We've also, in the last several years, gotten more involved in emergency preparedness, planning, and response activities, just as we're seeing more of these types of climate-driven disasters in the state. We've been called on to use our subject matter expertise. And so we make ourselves available to local health, to healthcare practitioners to try to help. But then we also try to focus on health and all policies approach to climate planning, recognizing that a lot of the climate work is going to happen outside of public health directly in terms of making decisions about infrastructure, about our energy systems, our community planning. So we also provide technical assistance to teams that are interested in doing that type of work. Next slide, please. Some of the communication materials that we have are shown here, and we have some sort of traditional communication materials. We have health and safety fact sheets on cold, heat, a series on flooding, on wildfire smoke, and your health. But we've also more recently started trying to develop communication materials that target specific audiences and might also try to reach people that a fact sheet just isn't going to interest them. It's not going to engage them. So there's an example here of a comic series that we just started working on, and we released the first one this summer. It's called The Talk About It. And the first one is, Can Climate Change Make It Harder to Breathe? So it's focused on how climate change impacts air quality, impacts health. And the scenario is a mother with her child at the doctor's office talking to the doctor about how climate can exacerbate asthma, can exacerbate these issues through a number of pathways. And we're hoping that more people will see themselves in these scenarios and not think about climate change so much as a political issue, as this massive global issue, but this is really something that affects us at home. We also started developing, after the 2023 wildfire smoke events, we really started focusing on developing materials around wildfire smoke and fine particulate matter. And another one of the new education tools that we came out with this year was a poster for schools on air quality, and it talks about the air quality index and what you should do when the air quality reaches a certain level, to try to communicate to some of the more vulnerable populations, which is children, and helping teachers be able to communicate about this with their students. So there's a teacher resource packet that kind of goes along with it, that and all of these materials, we're working on getting them put into what's called our clearinghouse, so people can order them for free. We do have some of the materials on there, some of our fact sheets, and like I said, we're going to work on getting more. The other thing we're doing is trying to get more of these things translated, and I think most of our fact sheets and some of our air quality guidance have been at least translated into Spanish and Arabic, and we have some that are also translated into Bengali. So that's very much a focus for us, is getting them translated, so our non-English speaking populations, who also tend to be more vulnerable, can also have these materials. Next slide. Another thing that we do with our educational resources, our communication resources, is a few years ago, we decided to pull them together into what we call seasonal resource packets. And these provide an overview of how climate is impacting Michigan's fall, winters, spring, summer. And it's meant to compile all the resources that we have about those seasons, which can include fact sheets, includes top level messaging, it includes social media posts that people can take and use themselves. So trying to compile those things together and make it easy for local health, for community-based organizations, for other local municipalities to be able to take this material and share it through their networks. Next slide. Another one of the areas that we focus on, like I mentioned in the intro for the program, is a health and all policies approach to climate planning. Our program started with very much a focus on adaptation. Adaptation meaning we recognize that climate change is already having an impact on people's health. We know that it will continue to have an impact on people's health, even if we were to get our greenhouse gas emissions down to zero tomorrow. There's still enough momentum in the climate system that it's still going to change. And we don't want to sound defeatist about climate action. We very much support climate mitigation efforts and reducing greenhouse gas emissions, but we also want to prepare our communities that are not designed for the type of climate that they're experiencing now, and certainly not the climate of the future. We want to help them establish a shared vision with the community, something that people can get behind, that centers people, that centers vulnerable populations, gets them involved. So we developed this planning guide for Michigan communities, and we're working right now with MSU School of Planning, Design, and Construction and the MSU Extension Program to pilot, or sorry, we piloted this approach in Marquette County in some of the communities there a few years ago, prior to COVID. And then we got some funding that we've started implementing this again with a few more communities. So we're working with Sterling Heights, Washtenaw County, and the Keweenaw band of Indian communities in the Michigan Upper Peninsula to further implement this. Next slide, please. As I mentioned, we've been more involved recently with emergency preparedness and response activities. And what that entails is our climate health program is continuously monitoring for certain conditions. So in the summer, we're looking at the National Weather Service heat risk tool to look ahead and see when Michigan might be experiencing, dangerous heat and get information out about that. We also do that for wildfire smoke. We're connected with Eagle, Department of Environment, Great Lakes and Energy, for those that didn't catch that earlier. We're connected with their meteorology team that does the air quality forecasting and issues the alerts and advisories. So when we get some sense that there is a potential heat event or smoke event or storms that could cause power outages, we're monitoring those conditions. As those events unfold, we also have some epidemiologists that can look at our syndromic surveillance, which is looking at or looking for spikes in emergency department visits as these events are unfolding. And we're able to push out messages through the Michigan Health Alert Network, which goes out to local health, emergency management. It does go to healthcare systems. We work with our communications office at MDHHS to post social media, and then also do press releases. And then we also work with others in that service specific vulnerable populations, such as the unhoused, such as maternal and child health, to try to get resources and information and a heads up to those groups, so those service providers can be prepared to try to respond themselves. One question that I had here that we've kind of been interested in is about our health alert network system. We don't have a great sense. It's kind of a one-way communication tool for us. We push out messaging. The group that we normally send it to, it says it goes over to like 6,000 people, but I don't really know who those people are, to be honest. And it does say healthcare. And I'm curious if anybody on here has heard of a health alert network system or has ever seen a message from the health alert network.
Yes, hi, this is Dr. Matthew. Definitely, they get the HON alert from Michigan, apart from the CDC HONs I have signed up for. So yes, we definitely do get, thank you.
Great. That's good to know. Yeah, I might follow up at a separate time, and we'll come back to another question later that might feed into this. But that's good to know. So we know, oh, sorry, Lisa.
I was just going to say, I think Carolyn has sent it directly to us, haven't you? I think somebody from your office has, and we've tried to put it in our up on our social media. I mean, I'm pretty sure I've received the notes, and I thought it came directly from you guys.
Yeah, you might have me or Caroline might send it. Sometimes we send it directly to partners as well, combined with some other messaging. So that's one way.
Yeah, and that is part of what we do to try to get that message out to those specific groups of folks. But it's a challenge. We're finding as we're in this space more, there's a gap between public health and emergency management in terms of what they're looking at and how they're messaging about these events. So that's something that we're also working on, is bridging that gap, making sure that they understand that climate change is driving these types of hazards and these events to become more frequent and worse in Michigan. So to have our review our plans and update them to reflect that. I'm going to go to the next slide. And this is a favorite slide of our health educator that supports our program, Stephanie. She does amazing work with our communications materials and is the inspiration and the brain behind a lot of our great materials. But she always wants to make sure that we talk about how climate change is actually very well, recognized and actually perceived by most of the public. And if you look at some of the surveys that are done routinely, we've seen over time how that data actually has increased. And so Yale Center for Climate Change Communications does these surveys pretty regularly, and in 2023 found that 74% of Americans and 70% of Michiganders think global warming is happening, versus only 15% who didn't. Similar percentages of people believe that global warming is causing harm to plants and animals as well as to future generations. But only 35% of people discuss it at least occasionally. And so there's a real stigma, of course, from politics about talking about climate change. And so one of the things we do is encourage people to talk about it, because you'll probably find more people than you think that would be interested in talking about it. And I think in particular, this group, can have influence, and so we're always encouraging people, just talk about it. It doesn't have to be in depth. It doesn't have to be complicated. Just, start talking about it. And next slide. So I want to spend a little more time taking what Carolyn presented before about some of the health effects, and maybe look a little deeper at how you might be seeing that within your practices. And we developed this next set of slides thinking about local public health and some of the spaces that they work in, but also healthcare and some of the spaces that you all are working in. So next slide, please. So the first area that you might start to see some of the impacts from climate change is in maternal, child, adolescent, and family health. We know that extreme heat increases the risk of preterm birth, low birth weight, and infant mortality. We know nationally that heat is the number one environmental killer, and that's also true for children and teens. It's the leading cause of death and disability of teen athletes. It seems like almost every year we're hearing one or multiple stories from across the country about this time of year when kids are going back to football camp or other sports activities where they're impacted by the heat. We also know that poor air quality is associated with increased risk of low birth weight and infant mortality. That's both with ozone and fine particulate matter, which are both connected to climate change. Air quality, specifically smoke from wildfires, is also associated with increased risk of premature death, increases in emergency department visits, and hospitalizations. There is very strong literature from the EPA and from other sources about the link between fine particulate matter and serious negative health outcomes. It takes a lot for the EPA to say that something causes something else. And they do say even short-term exposure, which is hours, to unhealthy levels of fine particulate matter can lead to heart conditions, respiratory conditions, and hospitalizations, and possibly even death. And so as we're experiencing more of these wildfire smoke events, we're really trying to get people to understand in Michigan that this is potentially the new normal. We could have smoky summers for a while because the hot, dry conditions in Canada are persisting, and it's just driving those wildfires to happen more frequently and worse. 2023 was their worst year. This year is setting up to be the second worst year, and 2024 I think was the sixth worst year for wildfires in Canada. Next slide, please. Another area that might resonate with you all is around infectious and communicable disease. So we talked a bit about vector-borne disease. Vectors, it can be complicated because ticks have a complicated life cycle. There's been studies done that potentially ticks would be spreading like they are even without climate change. But what we do know is that climate change certainly isn't. It's creating the conditions that are very conducive for the black-legged tick, for other ticks that are moving this direction. But one of the things that Carolyn mentioned early on was that increased frost-free day, increased frost-free season. And so what that means is we're all going to be outside more often. And it means ticks are going to be active more often because anytime it's above 40 degrees, ticks can be active. So we're potentially increasing that opportunity for exposure through this. We also look at the spread of mosquito-borne diseases like West Nile virus. A very unfortunate story was I just saw today, Kent County Health Department just released that there was one person in the county who had a confirmed case of West Nile virus, and they just died today from West Nile virus from that. So very real and present concern there. As was talked about, it's an emerging issue throughout Michigan, and so it's something that we partner with another part of MDHHS called the Emerging Zoonotic and Infectious Disease, EZID. They're sort of the experts on the vector-borne and waterborne disease area. But we work with them to communicate about how climate change is potentially increasing the risk of these, and also taking their data and helping to promote health and safety information. And I see someone's got their hand up, so I'll stop.
Hey, yes, this is Dr. Matthew. I'm infectious disease actually. And so with that expertise and that understanding, and I've been seeing the email, the exchanges, the messages going about Lyme, and of course, the concerns about West Nile. I was trying to figure out whether there's a map from Michigan that shows where, for example, we might have more of the Culex pipiens, the one that apparently doesn't like clean water, likes dirty water, stagnant water, and therefore contributes that way to West Nile compared to the other Culex, which likes clean water. So I was wondering if that map is somewhere on the health department side that I can find easily, or because I have to, or if you can, someone can put in the link in the chat.
If I can't say it's exactly where it is, but if you were to search MDHHS EZID, that'll take you to the Zoonotic and Infectious Disease page, and they have an annual report that goes through all of their vector-borne diseases, both arbovirus and so forth. If we have it, I'm guessing it would be in there, and if not, I'm happy to connect you to the folks that might be able to help you get that.
I think what I would be interested is real-time information coming out when we identify West Nile activity in birds and other areas, reservoirs. That's what I think we need to be alerting people to. I don't know. I don't recall getting any of that in the MiHAN alerts, MiHAN emails that come out.
So yeah, that's a good point. And our program doesn't fully focus on that. I think a lot of that is covered by the local health departments who do the surveillance for vector-borne disease. I know the state program has done a lot of training for local health departments and to help them understand that they need to be doing vector-borne disease surveillance and how to identify and report. But I agree, it seems to be at a local level, and I don't see as much at a statewide level.
Yeah, I think there's some report that, thank you, Caroline, you put in, and it shows the 2024 data, but also the currently what's going on as of August 15, 2025, and states about 3 human cases. And yeah, so, but this is the information, for example, if you're talking about communications, I've not seen this come out to me. It's not been fed to me. I have to go look for it, right? So that's where I was thinking about communications coming out would help us. That was helpful. Thank you.
We will note that. Yeah, I appreciate that feedback. I think we can go on to the next slide. The next area is chronic disease and injury prevention. So with chronic disease, people with chronic diseases are often most at risk for climate impacts on their health. We discussed that earlier. Cardiovascular and respiratory diseases put people at higher risk of health impacts from extreme heat and wildfire smoke. Um, there's also a lot of conversation about the compounding effect. If you live in an area that has higher ambient levels of poor air quality, and then a wildfire smoke event happens on top of that, that's going to have a compounding effect. But then these climate events, big storms where there's power outages, ice storms, flooding, they can disrupt people's ability to access healthcare, food, their overall well-being. We also mentioned earlier the mental health aspects of these reoccurring types of events. And then we're also focused on, as we promote and support climate mitigation actions, that can also help prevent some of the conditions that are driving some of these chronic diseases. So helping to improve air quality by reducing fossil fuel burning, energy sources or cars, vehicles in a community. So there can be co-benefits both for climate and public health when we're taking action on these things, and we often try to highlight that work as well. And next slide. So here I want to give the group an opportunity to give us a little more feedback. We've heard some. Very much appreciate the note on the vector information. So maybe even thinking some about the second bullet, like how else could our program, could our area support you in addressing the health effects of climate change? Part of the reason we can continue to work with Lisa and MiCCA is we're constantly looking for ways to support and collaborate with each other. So we are open to feedback and your ideas of how our program can support you and your work.
Hi, this is Paula. I'm in Traverse City. I work at the Groundwork Center. I work in community health mostly. So I'm not in I'm in a community-based organization, but I do food access work primarily. But my organization works on climate and health topics, and we do a lot of community education. So I think we can do some partnering on some of our next education programs that we have for other health providers in the general community, if you would like.
Yeah. Yeah, that sounds like a good. So is it there's an opportunity to share some information through this network, through this group?
Yes, yeah, through my organization. We do webinars, we do cannabis discussions in Traverse City quite a bit on environmental topics. So we could definitely do a climate and health panel and record it as well.
We're getting a little feedback, Paula.
We have I think I got the gist of it. And um, Carolyn is our community engagement coordinator that supports. We also have an outreach team that's separate. And so we do have folks that can attend different events, can table, can bring materials, can do a version of this presentation. So yeah, feel free to reach out to us directly, and we have people now too that are set up across the state that are regional outreach folks. So we have some that are closer, and maybe based in the communities too. And I saw a couple hands up. I wasn't sure who was first.
Trini's first, Dr. Matthews.
Yeah, thank you. So I get emails through Laura. Again, I think pretty much all licensed professionals now get that emails through Laura. So that would be another email listserv for you folks to send message out to people. Now, again, bullet points to the point saying that, and resources would be an information. But fortunately, because of the pandemic, Laura's communications started occurring before it was not. And so I think that would be a list so you could avail of to alert people on climate impacts of health. And along those lines with Laura, I don't even know, we have, of course, this might be something that people may not like, but we do have the required CME for state licensing, for example, related to child abuse, right? And certain other things. But this might be something to have a conversation with Laura, whether licensed professionals should have some kind of a CME once in their lifetime, at least on climate change and the conversations, right? So again, I'm just thinking about if we are, in some respects, it is child abuse, kind of also preventing child abuse, knowing about weather and knowing about how, especially when we heard about, bites happening to kids, if you're not looking after kids and they're playing outside or things like that, right? So I think I'm just suggesting this is something to ask Laura if this could be a CME that is accepted in some form or the other, even under risk management, because sometimes risk management is required, if not as a full climate change CME requirement, just like how we have to undergo trafficking, child abuse kind of thing. So just thought about that.
Very, very interesting idea.
I agree wholeheartedly. I felt this so strongly. As a pathologist, I was required to, never prescribed, required to keep my license opioid training, which, I think is really important, but this is impacting everybody, every aspect of their clinical practice. It absolutely should be part of what's required to maintain licensure, in my opinion. And I would say our parent organization, the Medical Society Consortium on Climate and Health, is working along with Columbia to try to develop different continuing education modules that on various topics related to climate change. And if people are interested in getting involved with developing certain modules, I could probably connect you with the people who are leading that. That's a great idea, though.
We've been very interested. I think we've talked about this, Lisa. Like we've had for years the desire, and we were at one point going to be developing sort of a training module webinar series focused on healthcare providers, but it was challenging for us to kind of find an audience and craft it the right way. So I feel like we've been searching for that right outlet and the audience. So yeah, that could present an opportunity for us.
I was also, you asked ways that we could utilize your materials, and we do have a couple events coming up, and Teresa's going to go over them, but I'm sure you guys are probably going to be at the MiCCA event, and then the day following that, am I still alive or did I? Yeah. The day after that, we're having a climate clinic on Lansing's lawn, the state capitol lawn. We're going to set up a tabling event, and welcome anybody to come. They're arranging meetings with our state legislators, and we'll try to arrive if people want to in their white coats and that sort of thing. And your materials, if you're okay with it, would be great materials to have on that table. And then we also are having our second annual meeting will be November 15th in Grand Rapids. And again, I think your materials are so excellent. I love the comics. They're really nicely, they're put together really nicely, and it would be nice to have some of those materials. If you're comfortable with that, we can, talk about how to do that. But if you're willing, we'd really appreciate that.
I was writing all these notes down. Because I can get with you.
Yeah, so we'll get the
Okay.
link to the
Yeah.
September days in the chat. And also we are having our conference in November. So we have a registration page up for that as well. But we're developing the agenda right now, but it's focused on climate smart healthcare. So we'll obviously be talking about, taking climate action from a health professional perspective, but also how the healthcare sector contributes to climate change and how to decarbonize within healthcare facilities. So those are good things to highlight. But since we heard some perspectives, I mean, for example, like the chronic Lyme, as something that, is difficult with climate change is definitively say that this health issue is a result of climate change, right? But as we're building up this database of stories, not only do they personalize the impacts of climate change, right? Making it a kitchen table issue, making it something that's relatable to people. It's also helping, I guess, document some of the changes that we're seeing. So I wanted to bring this slide up again for people to share their stories. Connie, if you're still on the call, your description about Lyme disease was really powerful. And, we'd love to hear from you as well. So I wanted to bring this slide back up. But something, I guess we're opening it up to a Q&A here with Erin and Carolyn. I'll bring up your slide here in case you wanted to promote your contact information. Do you feel that Michigan's reputation as a climate haven sometimes makes your work a little bit more difficult? I mean, what do you feel the engagement is around climate and health?
Yeah, that was a good question. I remember in the journal Nature a few years ago, I think it was, there was, and some other outlets, there was sort of almost tongue-in-cheek sort of articles about how like they pinpointed the safest place from climate change, and it was in Michigan. And it actually worried, and it was in the UP, and we were working at that time with Marquette, and they brought that up to us. They were worried, what if people start moving here in droves and we're not ready for that? So there it was kind of like the flip side. I think some people are looking at climate action and preparedness as an economic development opportunity for Michigan. But they're also looking at it. I mean, Michigan recently is a state that's been losing population, and so like, oh, maybe this will bring people back. But um, there's, but the folks that are having to leave their communities where they're living, it's because they're being forced to leave, and so you're seeing climate refugees already, coming in from other countries. They're coming in from across the U.S. They're having to resettle in areas. Sometimes these are, English is not their primary language. Maybe they don't speak English at all. So it can create difficulties. And I think though Michigan doesn't have the same, we don't have hurricanes directly. We don't have the same type of heat effects that states like Arizona have. But that doesn't mean that Michigan doesn't have its own concerns. And I think a lot of it is because our communities, I said this earlier, our communities are not designed to handle the climate that we now face. And if you tie that in with things like historic redlining that happened in communities where there's under investment in a lot of our communities where there's little tree canopy and the housing and other infrastructure is not capable of protecting people against this. So there's a lot of issues that we face in Michigan, even if we're not the epicenter of like the worst disasters from climate change. And on climate and health overall, I would say, one of the things that's been interesting in this current political environment that we're in, where we went from historic investments in climate action to the rug getting pulled out from under a lot of people. One thing that I continue to say is there was little investment in the public health space around climate change, even in the prior administration. It was pretty much level funding for CDC, for the CDC Climate and Health Program. I think there was funds around environmental justice, and some of the work kind of and the funding was funneled through environmental justice work. And EPA, for instance, did as much as they could to get money into the hands of the communities and organizations at the front lines, which had its own issues because of how fast that it had to happen, and there wasn't a lot of capacity building. But I'll say like this space has been chronically underfunded. And if public health is, we're the ones doing the surveillance and kind of collecting the data to show where the impacts are happening and how bad it is, especially local health needs the resources to be able to do that. I think it goes to the point, I think Dr. Matthews is it about, not hearing about some of these things. And I think that's just a symptom of the public health system not having the resources to fully develop these surveillance and response programs the way that we need to. That's probably beyond the answer you were looking for, but I just kind of went with it.
No, thank you. You addressed a lot of I was interested in. Are there any other questions from the group?
I was just going to ask quickly, did the Office of Climate Change and Health Equity help at all in the last administration? OCHA?
Yeah, they were helpful. Actually, one of the resources that they created was a seasonal climate and health outlook, and we've replicated that for Michigan and continue to use that because we felt it was very helpful to compile the different longer range forecasts and tools that were out there and put a climate health framing on it. And we distribute that through our newsletter, which you can sign up for at our website there if you go. And that in particular, I think was a big loss. I mean, Dr. Belvis was an incredible leader in that space.
He's great.
But I felt like it really divided at the federal level. I feel like there wasn't a lot of coordination amongst some of the agencies, and it did divide some of the funds that I think went from applied public health to more research type activities. And I felt like that was a bit of a mistake. Not that the research isn't also important, but the applied public health really needs support.
Gotcha. The keynote speaker, by the way, on November 15th is Aparna Bull, who was in the Office of Climate Change and Health Equity in the last administration. This has been terrific. Let Teresa take it.
Yes, thank you so much for your, um, I know that you could probably, I have a long list of questions I could keep you here all night with. Hopefully I'm still here.
You're kind of breaking up a little
I'm
bit.
getting a note that my connection is not stable. But if y'all
Yeah, Teresa, you're breaking up quite a bit. I think she just went out. So I'll close up and just say, I can't thank you both enough for your presentation. This is really important material, and I loved the discussion here and the input from everybody in the audience. I think this degree of collaboration is really important and potentially helpful, and maybe we should continue to think about it, even though it wasn't a huge turnout. Well, the information you guys shared was really good, both directions, I think. And I hope you guys felt that way too. So huge thank you to each of you. All of you, everybody who's here.
we took lots of notes. I saw Carolyn writing, I was writing, lots of good ideas for us to take back. Very much appreciate it. Welcome, or we're happy to come back for future opportunities as you have them, and look forward to the continued collaboration.
Absolutely. Thank you
Thank
for
you.
having us, and thank you for everyone joining in.
Thank you for the great presentation. It was very helpful.
Very good.